Have you ever wondered why some people seem perfectly healthy today, only to pass away the next day? The answer might be hiding in the darkness of night, in symptoms so subtle they're mistaken for normal aging or a restless sleep. Tonight, I want to talk about something that could save your life, or the life of someone you love. Something that happens while we sleep, silent and deadly, affecting thousands of seniors every year. I'm talking about nocturnal strokes linked to undiagnosed heart failure, a combination so dangerous yet so overlooked that it deserves your full attention right now. What makes this topic so critical is that these strokes don't announce themselves with dramatic symptoms during daylight hours. They creep in during the night when our guard is down, when our bodies are supposed to be resting and recovering. By the time morning arrives, permanent damage may already be done. The tragedy is that many of these strokes are preventable if we know what to watch for, if we understand the warning signs our bodies give us, and if we act quickly when those signs appear. Let me start by explaining the connection between heart failure and nocturnal strokes, because understanding this relationship is crucial. When we talk about heart failure, many people imagine a sudden, dramatic heart attack. But undiagnosed heart failure in seniors is actually a gradual process that develops quietly over months or even years. The heart doesn't stop working entirely. Instead, it becomes less efficient at pumping blood throughout the body. This inefficiency might seem like a minor problem at first, something that only causes occasional fatigue or slight breathlessness. But the consequences run much deeper and more dangerous than most people realize. As the heart struggles to pump effectively, fluid begins to build up in the body, particularly in the lungs and legs. During the day, when we're upright and moving, gravity helps keep some of this fluid in the lower body. But at night, when we lie down, that fluid redistributes. It moves into the chest and lungs, making breathing more difficult. This is why many seniors with undiagnosed heart failure experience shortness of breath at night, why they wake up gasping or coughing, why they need multiple pillows to sleep comfortably. These aren't just inconveniences or normal parts of aging, they're warning signs of a heart struggling to do its job. Here's where the danger multiplies. When the heart isn't pumping efficiently, blood flow slows down throughout the body, including in the heart chambers themselves. Slow-moving blood tends to form clots, similar to how water that sits still becomes stagnant. These blood clots can break loose and travel through the bloodstream until they reach a blood vessel too narrow to pass through. If that vessel is in the brain, the clot blocks oxygen-rich blood from reaching brain tissue. Brain cells begin dying within minutes. This is a stroke, and when it happens during sleep, we call it a nocturnal stroke. The nighttime makes everything worse. During sleep, our heart rate naturally slows down. Our blood pressure fluctuates. Our oxygen levels can dip slightly, especially in seniors who might have undiagnosed sleep apnea or other breathing issues. For someone with heart failure, these normal nighttime changes create the perfect conditions for a stroke to occur. The combination of sluggish blood flow, potential clot formation, lower oxygen levels, and fluctuating blood pressure creates a dangerous scenario that unfolds while we're unconscious and unable to recognize what's happening. What makes nocturnal strokes particularly devastating is the delay in recognition and treatment. When a stroke happens during the day, symptoms are usually noticed immediately by the person or those around them. Help can be summoned within minutes. But when a stroke happens at 3 in the morning, precious hours may pass before anyone realizes something is wrong. Those hours matter tremendously. Brain tissue dies rapidly without oxygen. Every minute counts when it comes to stroke treatment. The window for administering clot-busting medications is narrow, typically just a few hours from the onset of symptoms. If a stroke happens at midnight but isn't discovered until 8 in the morning, that treatment window has closed, and the opportunity for the best possible recovery has been lost. Now let me share the 5 sneaky symptoms of nocturnal strokes that every senior and every caregiver needs to know. These symptoms are subtle, easily dismissed, and often mistaken for other conditions. But recognizing them could mean the difference between life and death, between full recovery and permanent disability. The first symptom is sudden nighttime weakness or numbness, particularly on one side of the body. This might feel like a heaviness in an arm or leg when you wake up at night. You might try to get out of bed to use the bathroom and find that one leg doesn't respond quite right. Your arm might feel strangely heavy, as if it's asleep but different somehow. Many seniors dismiss this as sleeping in an awkward position, as a pinched nerve, or as arthritis acting up. They go back to sleep, expecting it to be better in the morning. Sometimes it does improve slightly, which reinforces the belief that it was nothing serious, but this weakness or numbness indicates that blood flow to the part of the brain controlling that limb has been interrupted. Brain cells in that area are dying. Waiting until morning to seek help allows more damage to occur. The second symptom is nighttime confusion or memory loss. Imagine waking up at night and feeling disoriented, not quite sure where you are or what time it is. This confusion goes beyond the normal grogginess of being awakened from deep sleep. You might forget why you got up, forget where the bathroom is in a house you've lived in for decades, or struggle to remember the current day or year. These episodes might last just a few minutes before clarity returns, making them easy to dismiss as simply being half asleep. But sudden confusion or memory problems during the night can signal that oxygen is being cut off from critical areas of the brain responsible for memory and orientation. Even if the confusion resolves, damage may have been done, and the underlying problem, that inefficient heart and potential for clots, remains. The third symptom is sudden severe headaches at night. Not the gradual tension headache that builds over hours. Not the familiar ache of a sinus problem. This is an abrupt, intense headache that can wake you from sleep, a pain unlike anything you've experienced before. It might come with nausea, vomiting, or sudden changes in vision. Many people take pain medication and try to go back to sleep, assuming it's a migraine or perhaps related to something they ate. But sudden severe headaches at night, especially in seniors with heart problems or risk factors for stroke, can indicate a serious disruption in blood flow to the brain. The pain signals that something urgent is happening inside your skull, something that requires immediate medical attention, not aspirin and hoping for the best. The fourth symptom is difficulty speaking or slurred speech. A caregiver might notice this when checking on a senior at night, or the senior might become aware of it when trying to call out for help or answer a question. Words come out jumbled or slurred. Thoughts are clear in the mind, but translating those thoughts into coherent speech becomes difficult or impossible. Speech might be unusually slow, with long pauses between words. Or the senior might use completely wrong words without realizing it, asking for a chair when they mean water. Like other symptoms, this can improve after a few minutes, leading people to think it was just tiredness or dry mouth from sleep. But difficulty with speech indicates that the language centers of the brain are being affected, that blood flow has been compromised in those crucial areas. This is never something to wait out or dismiss. The fifth symptom is sudden vision changes or loss in one eye. This might manifest as blurred vision when waking at night, seeing double, noticing dark spots or shadows in your field of vision, or experiencing complete but temporary blindness in one eye. Vision problems at night are particularly easy to dismiss. People think their eyes are just adjusting to darkness, that they need to clean their glasses, or that it's a normal part of aging eyes. But sudden vision changes, especially those affecting only one eye, can indicate that blood flow to the vision centers of the brain or to the eye itself has been disrupted. The retina and the visual processing areas of the brain are extremely sensitive to lack of oxygen. Damage can occur rapidly and become permanent if blood flow isn't restored quickly. These 5 symptoms share common characteristics that make them dangerous. They're subtle enough to dismiss. They sometimes improve on their own, which falsely reassures the person that nothing serious happened. They occur at night when judgment is clouded by sleepiness and when getting help feels more difficult. And most critically, they indicate that a stroke is happening or has happened, meaning every minute without treatment allows more brain damage to occur. So what should you do if you or a senior you experiences any of these symptoms? The answer is simple but critical. Call emergency services immediately. Don't wait to see if symptoms improve. Don't wait until morning. Don't try to drive to the hospital yourself. Call for an ambulance right away. When you call, clearly describe the symptoms you're observing. Mention if the person has known heart problems or other risk factors. Note the exact time the symptoms began, because this information helps doctors determine which treatments are safe and appropriate. While waiting for help to arrive, keep the person calm and comfortable. If they're in bed, help them into a safe position, slightly elevated if possible, but not forcing them to sit upright if that's uncomfortable. Don't give them food, water, or medication unless instructed by emergency services, because some stroke treatments require an empty stomach or could interact with medications. Stay with them, monitoring their condition and noting any changes. If you can, have their medical information ready, their list of current medications, their medical history, anything that will help emergency responders provide the best care quickly. But treatment after a stroke is only part of the picture. Prevention is equally important and far more desirable. If we can prevent nocturnal strokes from happening in the first place, we avoid all the devastation they cause. Prevention starts with recognizing and treating the underlying heart failure that creates the conditions for strokes to occur. Regular medical checkups become absolutely essential as we age. These visits aren't just formalities. They're opportunities for doctors to detect heart problems before they become severe, to monitor blood pressure and cholesterol, to identify irregular heart rhythms that increase stroke risk, and to adjust medications as needed. If you're experiencing any symptoms of heart failure, shortness of breath, especially when lying down, persistent coughing, swelling in the legs or ankles, unusual fatigue, rapid weight gain from fluid retention, tell your doctor immediately. These symptoms deserve investigation, not dismissal, as normal aging. Diet plays a crucial role in preventing both heart failure and strokes. A heart-healthy diet emphasizes fruits, vegetables, whole grains, and lean proteins, while limiting sodium, saturated fats, and processed foods. High sodium intake causes fluid retention, making heart failure worse. Saturated fats contribute to cholesterol buildup in blood vessels, increasing stroke risk. Making dietary changes isn't about deprivation. It's about giving your heart and brain the best possible chance to function well. Work with your doctor or a nutritionist to create a diet plan that's both healthy and enjoyable. Hydration requires balance. Staying adequately hydrated is important for overall health and helps prevent blood from becoming too thick and prone to clotting. But excessive fluid intake can worsen heart failure by increasing the volume of fluid the failing heart must pump. Your doctor can guide you on the right amount of fluid for your specific situation. Physical activity, adapted to your abilities, strengthens the heart and improves circulation. This doesn't mean running marathons. It might mean walking around your home several times a day, doing chair exercises, or working with a physical therapist on a gentle routine. Movement keeps blood flowing, reduces the risk of clots, and helps maintain overall cardiovascular health. Sleep position matters more than many people realize. If you have heart failure or are at risk for it, sleeping with your head and upper body elevated on several pillows or an adjustable bed can reduce fluid buildup in the lungs and make breathing easier. This simple change can improve sleep quality and reduce some of the nighttime stress on your heart. Medication management is critical. If you're prescribed medications for heart failure, blood pressure, cholesterol, or to prevent blood clots, take them exactly as directed. Don't skip doses because you feel fine. Don't stop taking them without consulting your doctor. These medications are working to prevent the exact catastrophes we're discussing. Keep a current list of all medications, including dosages, and share this list with every healthcare provider you see. Creating a monitoring system at home helps catch problems early. Keep a journal noting any unusual symptoms, no matter how minor they seem. Record nighttime awakenings, changes in breathing, episodes of confusion or weakness, headaches, vision changes, anything outside your normal experience. Share this journal with your doctor at regular visits. Patterns that might not be obvious from individual incidents become clear when documented over time. For caregivers, vigilance becomes part of your responsibility. Check on seniors during the night if possible. especially if they have known risk factors. Notice changes in their speech, movement, or mental clarity. Don't dismiss complaints or unusual behaviors as normal aging or attention-seeking. Trust your instincts. If something seems wrong, investigate. It's better to overreact to a false alarm than to underreact to a genuine emergency. The reality is that nocturnal strokes linked to undiagnosed heart failure represent a silent epidemic among seniors. They happen far more often than most people realize, and they cause tremendous suffering that could often be prevented with awareness and action. Every family should know these warning signs. Every senior should feel empowered to report symptoms without fear of being dismissed or seeming difficult. Every healthcare provider should take nighttime symptoms seriously and investigate thoroughly. If this information has opened your eyes to dangers you weren't aware of, please share it. Talk to your family members about these symptoms. Share this with friends who care for aging parents. Post it in senior centers or community groups. Subscribe for more health information that could save lives. Leave a comment sharing your experiences or questions. The more people who understand these risks, the more lives we can save. The more families we can spare from the devastating consequences of missed strokes. Your health and the health of your loved ones depends on knowledge and action. Don't let ignorance or denial put you at risk. Don't dismiss symptoms that could indicate serious problems. Be vigilant, be proactive, and be willing to seek help when something doesn't feel right. Your life, or the life of someone you love, may depend on the choices you make tonight.